Good afternoon, ladies and gentlemen. Thank you so much for joining us today. This is the second part of our series of CHReaD webinars. And the theme of today's webinar is, we'll be focusing on prioritization of health research, development, and innovation in the COVID response in Kenya. As you may all know or have observed, COVID has come to expose our underbellies as far as research, development, and innovation is concerned, especially in health. And therefore, we need to have conversations on how can we improve on this area. And today, we are specifically going to be looking at how can we improve access to medical products and and for today, you have a very excellent panel with us who I'm going to introduce in a short while. The webinar today is organized by two organizations. One is AMREF. I'm going to start with PATH. PATH is an international organization based in Kenya. While PATH is a global organization with strong presence in Africa, and it's dedicated to achieving health equity so that all people and communities can thrive. Through partnerships, PATH drives public health solutions that meet the most pressing needs of families, communities, and countries. PATH specialties ranges from across health systems, diagnosis, drugs, devices, vaccine research, and development policy and advocacy. AMREF, who is the other partner that has helped organize this webinar, is an international organization. It's an international African organization. The headquarters is in Nairobi. AMREF is currently running health programs in over 35 countries in Africa, of course Kenya included, where the organization reached all 47 counties in Kenya, that is. AMREF's vision is lasting health change in Africa, and its mission is to increase sustainable health access to communities in Africa through solutions in human resources for health innovations, services and solutions, and investments in health. And for CHReaD is a coalition of different organizations who have come together to advocate for health and to advocate for research in health. And with me is a team of panelists, but I'm going to introduce them in a little while. Article 43 of the Constitution of Kenya guarantees every Kenyan enjoyment of the highest attainable standard of physical and mental health as a fundamental human right. The Constitution of the World Health Organization emphasizes this achievement by any state in the promotion of health, in promotion and protection of health, and as a value for all. In the age of globalization, pandemics and epidemics such as COVID-19, progress made in public health in one country such as Kenya has an impact on the international community as a whole. It is both a natural consequence of mandated responsibilities and increasingly a practical necessity for countries such as Kenya and other stakeholders to coordinate and cooperate ever more closely on issues such as patterns of innovations, access, legal and policy factors affecting production and dissemination of medical technologies and the interplays between public health, international trade, rules, and other intellectual property. Access to these services, of course, is an element of fulfillment of the rights of everyone to enjoy the highest attainable standards of health. And the WHO framework for access to medicines recognizes that lack of access to medical technologies is rarely due to a single isolated factor, and thus includes rational selection and use of medicines, a country's regulatory systems, affordable prices, sustainable financing, and reliable health and supply systems with quality as such an underpinning elements. Regulations of medical technologies address essential policy objectives, which include that products must be safe, efficacious, and of adequate quality. Yet, regulation also shapes the landscape of access and innovation. High safety standards require the generation of more data and thus increases the cost of innovation. Unjustified regulatory barriers and lengthy marketing authorization processes delay access to the needed medical technologies, and Kenya must put in a concrete plans early enough to address such barriers. And you're all a witness that we have been experiencing these barriers that really delay our adoption of technology and even rollout of medical technologies that we really need, which could have averted deaths if they were adopted quite fast enough. A key challenge for this regulatory system is the steady increase of substandard and falsified medical products, especially during such pandemics. The latest report released by the African Union, which is titled Low and Middle Income Countries Worst Affected by Poor Pharmaceutical Governance, Weak Technical Capacity, and Poor Supply Chain Management, indicated that Africa accounts for 42% of substandard and falsified medicine in the world. I'll repeat that, 42%, quite shocking. Substandard and falsified medical products are posing serious public health threat, not just in Kenya, but in globally, despite the tremendous efforts that the country has put already in strengthening regulatory systems, blocking all the avenues that would allow such medical staff into the market. To effectively combat these medical products, a mix of measures is required, including but not limited to: 1, enforcement of good manufacturing practice standards, regularly reviewing and strengthening national laws governing medical products, medical products regulation, such as the proposed Kenya Foods and Drugs Authority Bill, border control and criminal laws, along with collaboration between legislative bodies, enforcement agencies, and courts at the national and international level. As Kenya joins the rest of the world in developing and preparing for COVID-19 vaccines and therapeutics, we must be cognizant that factors affecting access must be addressed with the honesty and brutality it deserves through policies, legislations that guarantees availability of these COVID products in sustainable quantities at prices that are sustainably affordable for patients, third-party payers, and health systems budgets. Having given this background, I'm going to give the opportunity to our esteemed speakers for today. And before I give them the opportunity to speak, I'm going to say who they are in a brief moment. Before I invite them, I just want to mention a bit of housekeeping. We want to hear from you, the participants. We want to read your feedback. We want to hear your comments, and we want to get inputs that are going to assist us in developing strategies that can facilitate access to these medical products. So for this, please feel free to share your questions and comments with us by submitting them in the chat box. At any time through this discussion, I'll be monitoring the chat box, and we'll be saving the majority of this for a bit of time to respond to these questions and also acknowledge your inputs. I will also invite you to join the conversation online by tagging us at PAD's tweets, at CHReaD Kenya, and at AMREF _Kenya, and at Stop TB Kenya. My colleague will be sharing a slide that is going to show us the social media handles that we can use to talk about this forum. Once again, welcome to this webinar. So to start us off, we are going to have Dr. Peter Bwiriri. Dr. Peter Bwiri, sorry for that. Dr. Peter.
Okay, thank you.
Sorry.
Yeah, go ahead, sorry. Yeah.
Okay, very briefly, Dr. Peter, welcome. A brief introduction. Dr. Peter is a medicines evaluation and registration at Pharmacy and Poisons Board, Kenya, East African Medicine Regulatory and World Health Organization expert. He earned his first degree in pharmacy, in Bachelor of Pharmacy from the University of Nairobi, and he also holds a master's degree in pharmaceutical sciences with management studies from Kingston University. He is an associate fellow of higher education, UK, and the World Health Organization country focal point at the Poisons and Pharmacy Board. Dr. Peter, you're very welcome to share with us how you feel that we can improve access to medical products in Kenya. You have the floor. Thank you.
Thank you. I'll be sharing some presentation slide. Okay, thank you. Can move on. Okay, my presentation today will focus on the following. This is a presentation overview. As we talk, we'll look at the regulatory framework and principles where PPP operates on, and the scope of health products and technologies that we regulate. We'll just give a brief overview on the regulation of clinical trials. We'll talk about the marketing authorization process, and now the key objective of today's meeting on increasing access to HPTs and strengthening regulatory capacity so that we can deal with the substandard products and counterfeit products. Please move on. So as we all know, there is no healthcare system that is viable without the health products and technologies. They are an integral part of any healthcare system. So the regulation of HPTs is done by the national regulatory authorities, and for Kenya, the Pharmacy and Poisons Board is the one mandated to carry out this responsibility. The Pharmacy and Poisons Board was established under the Pharmacy and Poisons Act, Cap 244, laws of Kenya. And the Pharmacy and Poisons Board started its activities within the Ministry of Health before we separated and became semi-autonomous. Now, the pharmaceutical and health policy requires that we ensure that the citizens have access to universal, essential health products and technologies. And this is by ensuring availability and rational use of safe, good quality, and efficacious, and also affordable healthcare products and technologies throughout our country. So a key strategy to this is to ensure a harmonized regulatory system that is based on sound science and evidence. Kenya is part of the East Africa Community Medicines Regulatory Harmonization Program, and we've really worked a lot to harmonize our regulatory approach within the region. We can move on, please. Okay, what is the scope of products, medical products or health products and technologies that Pharmacy and Poisons Board regulates? Currently, we're regulating medicines, and particularly human medicines. We were regulating veterinary medicines, but eventually they were taken to another board. But I think with the Health Act, we will be regulating all the products because they will be brought to one umbrella body. Again, we've got complementary or alternative medicines that most people call herbal medicines. We also regulate that. Another sector or key area we're regulating is the medical devices and in vitro diagnostics. We are moving to regulate towards regulation of bland and bland components. Currently, we are regulating blood products, but now we are moving, or we set policies into regulation of blood and blood components that will include licensing of facilities, including hospitals, Kenya National Transfusion Agency, the KNBTS, we'll be looking at that on how to regulate the supply of blood and blood components. This is something that is almost being implemented. And we have a committee, an expert committee on blood and blood products that will be the technical arm of the Pharmacy and Poisons Board. And this will be in collaboration with the experts within the board to regulate blood and blood products. We are also regulating tissues. That includes all the areas that would require tissues, including transplants and all that. We are also regulating radionuclides and radiopharmaceuticals. And a good example is Aga Khan Hospital that we've helped in establishing of a cyclotron facility, which is a manufacturer of radiopharmaceutical within radionuclide and radiopharmaceutical within the Aga Khan facility. Another area is food supplements and borderline products. And also we're moving into cosmetics regulation. Thank you. Next slide. Okay, we've already talked about that. The mandate is to ensure there's a supply of the good quality, safe and efficacious health products and technologies. Another thing is the Pharmacy and Poisons Board also regulates the practice and profession of pharmacy. How are we regulating? This is the framework. We've got the laws, and the principal law is CAP 244. We regulate narcotics and psychotropic substances under the Act number 4 of 1994. And also we are anchored within the Umbrella Act of Health Act of 2017. In addition, we got rules for regulation. We have gazette notices, and also we develop guidelines that are shared within to the stakeholders as per the requirements of the Constitution. Now, looking at what are the aspects does the Pharmacy and Poisons Board regulate? We look at the pre-market and the post-market. And the pre-market mainly is the issuance of marketing authorization. And issuance of marketing authorization carries out two components. One is the assessment of the product dossier to ensure to look at the quality of the product and to look at the efficacy and safety of the product, particularly by reviewing the clinical trials data. Another component also for the local trials is the regulation of clinical trials within the country. If we can move on to the next, please. The post-marketing component requires that we look at the pharmacovigilance, that is the reports that come from consumers, that come from healthcare facilities, the hospitals, pharmacies, and also that are channeled by the marketing authorization orders. So we look at the pharmacovigilance. We also carry out post-marketing surveillance where our teams go out, sample products, and subject them to testing and using accredited laboratories. And our accredited laboratories are the National Quality Control Laboratory that has the WHO pre-qualification. We've got MENS, and also we've got our laboratory within the board, but that is just for they're called for the minimal tests, but for compendial tests, we go to this accredited laboratory, National Quality Control Laboratory and MENS laboratory. I've already talked about the process of marketing authorization, and we know the objective for the marketing authorization is to ensure that the products are safe and efficacious. They're safe, efficacious, and are of good quality. And we'll move on to the next step, please. Next slide. Okay, how do we ensure the different ways of evaluating the dossiers that are submitted to us? The first one, we use the national route where we do full dossier evaluation. Assuming no one has done that dossier, we do complete evaluation. We're using another mechanism that we've implemented recently, and this is the reliance mechanism. And the reliance mechanism makes it easier for the product to be easily accessed, reduce time to marketing, because we are using dossiers or assessment reports that have been done by other authorities. And one of the authorities is the WHO pre-qualification program or team. It's now called WHO pre-qualification team. And some of us, myself included, I work under this program, WHO pre-qualification team, that looks at the products that will be supplied to globally, and particularly to be accessed by the UN body. So I participate as a quality expert in this program. We also have another route, which is WHO collaborative procedure on SRA registered or approved products. That is, we look at like if a product is registered by the US FDA or by European Medicines Agency, it can also go through the WHO, and it's easily registered through the national medicines regulatory authorities. Kenya is a participant in the EAC MRH program, and we do as joint assessments. This is another area. Once we do joint assessments, all products that have been approved by this program are supposed to be registered, automatically registered in the member states, and that is what we're following. Another area is the IGAND MRH, which has been newly established. Our assessors are also, or our experts are participating in this program. Thank you. Can move on. Okay, the East Africa community experts, myself included, we've come up with a procedure for registration of API, and this will facilitate a lot, and there will be a trigger to manufacture of APIs within the region and within Kenya, hopefully. It will also reduce time to registration, because the API data will already have been looked at. It is the API section really wastes a lot of time. So it will have two goals: to stimulate manufacture of API within the region, and also to reduce time to registration. We have followed the SRS, like the WHO pre-qualification program that has WHO API CPQ, and the EDQM that does the certificate of suitability to European Pharmacopoeia. These are the two key agencies that we are following in setting up this EAC registration within our country. We have also established a bridge procedure for evaluation of products, and thus reducing the time taken for product to be registered, and thus increases time to market. Can move on, please. Our normal timelines, as you look at, is when you look at the normal timeline of first in, first out, we usually take 24 months to evaluate. The fast track, we follow fast track priority medicines or critical medicines, and also for locally manufactured products is another way of stimulating or making our local industry bigger by or reducing time to access to market. We also use the WHO pre-qualification procedure where we register products within 90 calendar days. And now, because of COVID pandemic, we've introduced emergency authorization procedure, and we do the review within the 7 days for a bridge assessment, whereby it has already been looked at by a stringent regulatory authority. And if it's an initial assessment, we carry out that review within at least 30 days. And with that, we've been able to register some PCR test kits that have been very useful in testing of COVID-19. We are also in the process of registering a rapid test kits that will meet the criteria. We've been testing, and we've been testing with collaboration with the Kenya Medical Research Institute that do validation. We are only now almost getting, we are almost hopefully getting the first rapid test kit that will be useful in this COVID-19 pandemic. Currently, the local manufacturing industry, we've got capacity, and we've got 40 registered. There are 41, but one of them is being shut down. So we've got 40 manufacturing facilities, and currently we have 35 that are operational. and 5 are new. They started building just a few years ago, like 5 years ago, and they are under qualification, and we hope that they will start producing products into the market soon. Thank you. Next. With the COVID-19, our medical devices team really have done us wonders and have done us very well. And this is the inspection and conversion of 36 manufacturers of apparels that have been very useful in combating this COVID-19 pandemic. So we've got 20 manufacturers in the export processing zone. We've got 4 of the manufacturers do manufacture of footwear. And 20 of these manufacturers are involved in manufacture of woven and non-woven fabrics. You've seen a lot of surgical masks that have been being used. Quite a number of them are from our local industry, which is a very good thing. It shows that we've been able to move in fast and do the necessary, that we provided the public and the citizens with the appropriate devices. Now, increasing access. How do we increase access? We can only increase access through these 3 main key areas. The first area is reduced time to registration. I've already talked about that we are doing fast tracking of critical products or priority medicines and the locally manufactured products. We are also reducing time to registration by following implementation of reliance mechanisms in marketing authorization issuance. And I've given a very good example is the WHO CRP, our collaborative procedure. We've talked about the EAC-MRH program. We've talked about EGAND. All those help us in reducing time to registration. Another proposal is reduced cost of HPTs. And one of the proposed implementation is price control. And this would be multi-sectoral. I don't know how long it will take for this to be implemented, and it's something that has been with us for quite a long time. And the former CS, the Cicely Karaoke, was very key in pushing for price control. But this one will require a lot of ministries to come together and see how this would be feasible. But one of the most critical areas is to promote local production through research and development. And the Pharmacy and Poisons Board has been really at the forehand and the forefront, and we really have moved so much. And through the UNINDO, which is a UN body, we've been able to facilitate our manufacturers to improve their standards. And thanks to this effort, we've got one of the local manufacturers as World Health Organization pre-qualifying products. And this facility is a universal corporation. Through technology transfer and through our effort and the UN body UNINDO in GMP roadmap, we were able to push this facility to higher standards, and they are capable now of supplying their medicines globally. And they are manufacturing antiretrovirals, which is a very good thing for the country. The next thing, I've talked about technology transfers. Apart from this, we've got other facilities that are underway, and one of the facilities will be manufacturing oncology products, among others. This facility is one of the multinationals that is domiciled in Bangladesh, and they're coming in Kenya. Hopefully, within time, they'll start manufacturing. This is one of the areas now you can see that will reduce cost of HPTs. Now, the next, and where really we need the ministry and the government of Kenya, we need to really move in fast, is to strengthen the Directorate of Pharmaceutical Services in order to first critically look at the country needs of the HPTs, look at improving or the research and development in partnership with the Ministry of Health, and particularly in partnership with universities and research institutes like CHReaD, so that they can come up with products that are easy for commercial utilization. And this one I'll call upon the ministry again will also look at ways of partnering with World Bank and other funders, global funders, so that facilities of Ministry of Health, University of Nairobi, or the Kenya Medical Research Institutes, among others, can be funded enough so that they can come up with new formulations, hopefully new active pharmaceutical ingredients. Another key sector is setting up the strengthening of Directorate of Pharmaceutical Services so that they are able to set up facilities for manufacture of critical products like vaccines. China is a very good example of how governments have come up with manufacturing facilities and they are able to supply the critical medicines to their populations. Thank you. Again, another area that we'll need to look at is also increased setting up manufacturing facilities for PPEs, which we don't have enough facilities. As you can see, we just converted apparel manufacturers to this. We need dedicated facilities for this. We also need manufacturing of disinfectants, and this can be facilitated through Kenya Medical Research, through setting up, through putting through the local industry, coming up with the industries by giving them incentives, through the ministry also coming up with manufacturing plants. It will be feasible. Next slide, please. Okay, now, strengthening of regulation capacity, especially to deal with substandard products and counterfeited products. The first, I've looked at 4 key areas that we can improve, and we're improving as a regulator, Pharmacy and Poisons Board. So we are increasing regulatory expertise. The first thing is increasing the number of personnel so that we're able to be more efficient, because our mandate has really ballooned within a very short period, and the number of personnel has not really been in tandem, increased in tandem. So our board has looked at how it can employ new employees. Again, also increase expertise. Our board usually sends people to universities for masters. Myself, I'm a very good example of beneficiary of this. I was sent for masters, and eventually I was able to get a PhD through one of the universities in London. They gave me a scholarship, which so when you increase expertise, you're able to get the best people doing the work, and that way you'll ensure that the best products are availed within our country. And PPB has a lot of a number of people that have masters and above. We need more personnel. That is the main thing we need. The next thing is to establish bioequivalence center. Kenya is working towards bioequivalence implementation framework. And we've got partners, the key partner being Kenya Medical Research Institute. And this will really help our local manufacturers to have products that have better quality and can even be exported outside, and also increase the number of products that they can manufacture, because today they're not able to manufacture a lot of products, because one of the reasons is that they cannot prove bioequivalence. We need a bioequivalence center within the country for that. We also need to strengthen our post-marketing surveillance directorate or division to look at easy way of detecting and surveillance of risks to quality, that is substandard products and counterfeited products. Strengthen the response to these risks. They will also be able to foster integrity of the supply chain, and also enhance, another facet is enhancing the quality control capacity, the national quality control laboratories, our mains, and any other facility, QC facility within the country. I've talked about enhancing cost effectiveness in access of HPTs, and this will look at pharmacoeconomic surveys that can really, we can be really helped by our economic scientists within the ministry, or pharmacoeconomic scientists within the ministry to do this. And also look at the pricing. The government can also carry out government subsidies to stimulate local manufacture of the active pharmaceutical ingredients, the manufacture of medical devices, and manufacture of in vitro diagnostics. You've seen the COVID-19, the way it can really put a country in problems, especially where there are restrictions by supplier countries. Kenya usually, or mainly takes, we import, most of our products come from India and China, and the third supply is the European Union. So wherever there are restrictions, you know, as a country, you suffer a lot, because they love to serve their citizens first before helping other countries. And I've come to the end of the presentation. Thank you so much.
Thank you so much, Daktari, for demystifying the Pharmacy and Points Board. You have also given us quite a lot for the advocates. I know members of CHReaD, I hope you are keenly following on the recommendation slide that Dr. Peter has brought up. You have brought up quite a number of issues which I thought as advocates we need to take up. There were many, but some of the ones that I've picked is the need for advocacy for increased funding to take up, to increase their capacity for doing research. We need to advocate for setting up for more factories to manufacture PPEs. I was also excited to hear that now we have a factory that that is manufacturing ARVs locally. I think that is very, very good to know. And you also mentioned about the need for increased personnel and increased capacity for personnel in research. Thank you so much. I want to remind the participants, please keep your questions coming and don't forget to engage us on social media. We are going to share the hashtags so that we can engage and let everybody know that we are doing this. Thank you so much. I want to move to the next presenter in the interest of time, and then we can give our inputs and questions at the end of the presentation. So thank you again, Dr. Peter. I want to invite the presenter. Our next presenter is John Henry Onyango. John Henry Onyango holds a degree in Bachelor of Commerce from the University of Nairobi. He also holds a master's in business administration from Strathmore University, and he's currently the acting managing director of Kenya Industrial Property Institute. John, you have the floor. Kindly let us understand more about the intellectual property. Karibu sana. John, you have the floor. Hello, John.
Hello, good afternoon. You can hear me now?
Oh, yeah, good afternoon. Welcome.
Good afternoon. Thank you very much. Thank you very much. This is a brief presentation in terms of the background, mandate, and functions of Kenya Industrial Property Institute. Kenya Industrial Property Institute is a state corporation under the Ministry of Industrialization, Trade, and Enterprise Development. It was established through the Industrial Property Act 2001, which was a repeal of the old Industrial Property Act of 1990, Cap 509. Kenya Industrial Property Institute is mandated to administer industrial property rights in Kenya. We are the regulatory body that oversees the administration of industrial property rights in Kenya. Now, let me just briefly share with you what industrial property rights entails. We have intellectual property rights. Intellectual property rights is divided into three branches. The industrial property rights, there is the copyrights, and there is the plant and the plant breeders' rights. So the plant breeders' rights is what deals with protection of new plant varieties. Whenever you come up with the new seeds for maize or other crops, This is administered through the plant breeders' rights that falls under a state corporation called Kenya Plant Health Inspectorate Service, KEFIS, under the Ministry of Agriculture. Then we have Kenya Copyrights Board. This deals with the protection of artistic and literary arts in the fields of films, in the fields of music, in the fields of drama, in the fields of books. That is Kenya Copyrights Board, which is also another state agency that falls now under the AG, Office of the Attorney General. Then there is now the industrial property rights. That is where Kenya Industrial Property Institute falls. That is why we are called Kenya Industrial Property Institute. We deal with the administration of industrial property rights. And our mandate is to promote inventive and innovative activities, facilitate the acquisition of technology through registration and regulation of patents, utility models, technovations, industrial designs, and trademarks. That is what the scope of industrial property rights. Just a little background. What led to the establishment of creation of Kenya Industrial Property Institute? You recall in 1990, Professor Arthur Bell, he used to be a researcher at CHReaD, discovered a drug called Cameron. It was a wonder drug at that time, at the onset of the AIDS pandemic. He discovered the drug Cameron. That was a time when there was no cure for AIDS. But when this was discovered, there was no legislation. There was no agency. There was no department that could deal with how to administer or register or protect this drug called Cameron. That is what led now to the enactment of this legislation of Industrial Property Act, and that led to the creation of Kenya Industrial Property Institute. Briefly, that is the mandate of KIPI. In terms of the broad functions, we consider applications for grant and registration of industrial property rights. We screen technology transfer agreements and licenses. Dr. Mbwiri talked about technology transfer, and I'll mention something about that. We provide industrial property information to the public and researchers for technological and economic development. And we promote inventiveness and innovativeness in Kenya. And that is what is really leading to inventions. And then we provide or organize training, competitions, and awards relating to industrial property matters. In terms of products and services which we render, we provide registration of patents, utility models, industrial designs, and trademarks. We provide for industrial property information. We provide advisory services with respect to patents, utility models, industrial designs, and trademarks. And we provide registration of technology transfer agreements and licenses. Now, what is a patent? A patent is an invention. When we talk about a patent is an invention. And when we are talking about the central role of intellectual property rights in access to products, here invention is at the core. So when we talk about patentability, what qualifies for patentability? What makes something qualify to be protected as a patent by the Kenya Industrial Property Institute? Because we are now talking of, say, for example, when we get a drug to treat coronavirus, what will be the relevant agencies looking for them to grant the rights, intellectual property rights for protection of that patent? There are three main criteria that we look at. One is novelty. You have heard of the novel coronavirus. Why do we call it novel? It is new. It is a new virus. It is a new strain. There are other viruses, but this is a new strain. So novelty, when you come up with a cure, it must be completely new, novel. that will make it be considered to be granted a patent. Number two is there must be an inventive step for anything, any product, any process, any technology leading to the production of a new product. There must be an inventive step. Inventive step means it is not obvious. It is not ordinary for the common person. It's not something that anybody in the street can be able to talk about. Inventive step, there must be no prior art, prior knowledge existing, leading to that process or that product. Third, industrial applicability or feasibility. Like now, a lot of energy, a lot of time, a lot of resources has been devoted towards inventing a cure for the coronavirus. This cure or this solution must solve the problem of mankind. So it must be applicable. You don't discover something that does not solve a problem. That is why research has to be relevant to solving the problems facing mankind. So the industrial applicability is a very important criteria. Intellectual property, how does it influence access to products, including COVID-19 treatment and prevention of products? First, I've talked about patents. When we grant you a patent is granted according to the Kenyan legislation in the Industrial Property Act 2001 is for a period of 20 years. If you discover a drug today, you will be granted the sole right or ownership of that invention for 20 years. Why 20 years? It is because of the research effort you have put in discovering that. You have spent money, you have invested your time, you have bought equipment even to carry out that research. And when now you have come up with that solution, you should be able to recoup your investment. So this period of time given to you is to enable you recoup the investment which you had put in researching and coming up with this solution. So after the 20-year period, this invention, it falls under the public domain. What it means is you no longer own it. Anybody can have access to this technology of yours. It is now in the public domain. So that is patent. Utility models is a lesser patent. Utility models, we call it a lesser patent. It is an improvement of what is existing. It is a modification of what is existing. So for utility model, we look at two major criteria. We don't look at novelty because it is an improvement, but we look at inventive step, there must be something new, and we look at applicability. And a utility model is protected for a period of 10 years. It also relates to a product or the process of producing a product. And then we have industrial designs, which is another aspect of industrial property right, which deals with the aesthetic features of a product. For example, if you take Mercedes-Benz, it has a unique shape or design, or Toyota, it has a unique, or BMW. That is what we call a design, or perfumes. I think ladies, you can see how they, or your shoes. Some are very small, how do you call it? The bit, very. So that design is what we protect as industrial design, and it is also covered for a period of 10 years. Then we have trademarks and service marks. Trademarks are unique identifiers of a product or service. A trademark enables consumers to identify product of company A from company B, so that there is no confusion in the marketplace. If it is a drug, we'll have different pharmaceutical companies coming up with different drugs for corona. They will have different trademarks, so that if you want a particular drug, you cannot confuse it. You will go for that particular drug. That is the importance of a trademark. Now, Over the period, the IP owner pays an annual maintenance. We talked of patents 20 years, utility models 10 years, IDs or industrial designs 10 years, trademarks 10 years. But every year there is an annual fee. This annual fee is to maintain your ownership, because the moment you don't pay the fees, somebody else can now access that product of yours because it will have fallen in the public domain. So the annual maintenance or renewal fees to preserve the ownership rights. Now, during the period that the patent holder of a product or of a technology or a process has the sole rights, during that entire period, the inventor has the sole rights of ownership and manufacture of the products. Nobody else can produce or distribute without an arrangement from the patent holder. In case of patents, after 20 years, the invention falls to the public domain and hence is available for exploitation by any interested party. After the 20 years, this technology is available for exploitation by anybody. And that is why at CHReaD, we have a database of all technologies or inventions that lie in the public domain. Now, these technologies can be commercialized by our SMEs and entrepreneurs. We don't need to reinvent the wheel. These technologies are there. Pharmaceutical companies can access these technologies as long as they are already in the public domain, so that they don't again have to research and come up with something new, purported to be new, while it is already existing. Now, this is an avenue that we can use to promote access to products or access to medicines, because these technologies are already there. The patent holder, the original inventor, had exploited it for the period he was granted and recouped his investment. Now it is available. Now, if you come and exploit it, you will have not invested a lot in research. So even the pricing, it will become affordable because you just access this technology and get into commercial production. The inventor can also transfer the invention, partly or wholly, through licensing and agreements. Dr. Mbwiri talked about technology transfer and licensing. Technology can be transferred even before the expiry period, because you can invent something, but you don't have the capacity or the capital to manufacture. So if you invent something and you don't have the capacity to manufacture or produce, you can transfer the ownership of that to a licensee. You can license somebody else under certain rights, depending on the kind of rights you want to accord, so that he can manufacture and produce under your name, or if it is a wholly transferred patent, then he will now be the one that engages in a full commercial production. So this screening and transfer of technology, CHReaD is the mandated organization that does this. Now, this is also an avenue that we can promote access and availability of medicine. If you take, for example, multinationals like Coca-Cola. It's a multinational with headquarters in the US, but we are manufacturing and bottling Coca-Cola here. So it is under contract manufacturing. There is some transfer and license agreement to manufacture or produce, market or advertise or distribute under certain rights. Now that is intellectual property rights that is now facilitating the conduct of business, because it's a tool of promoting business. Kenya Industrial Property Institute has access to various international databases, which I mentioned, holding important patent information in all scientific fields: biomedical, pharmaceutical, electrical, agribusiness, all fields, scientific fields. We have access to these databases. And these databases, we can enable researchers from universities, from research institutes, SMEs, entrepreneurs to access and see what is available for exploitation. Now, this is a challenge in our country because you find SMEs, for example, the micro and small medium enterprises, are not in a position to exploit this because you find people are trying to reinvent the wheel, but we have access and we keep on creating awareness so that we can be able to provide this information to the SMEs that they can use to commercialize in terms of producing various goods and services. Ladies and gentlemen, that is my brief presentation on the central role that industrial property rights play in promoting access to products. Thank you.
Thank you so much, John. That was very, very informative. I now know the difference between a novelty, a utility model, an industrial design, a trademark, and how the patency period for each one of them. To me, it has been such an informative session. I hope it has been for everybody. I have quite a number of questions that have come through, and I will encourage the participants again to continue sending your questions. And I always say not just questions, but inputs, because this is a webinar for each of us. I'm sure each of us have something new that we can offer to this conversation. So feel free even to send your inputs. And I am going to go through some of the questions that have come up. And the ones I have are to Dr. Peter. Dr. Peter, the first question is, we have seen a level of hesitance and negative sentiments from the public around the fast-tracked COVID products. What is PPB and other government agencies doing to win public confidence for these products? Again, it is assumed that once COVID-19 vaccine and therapeutics will be available, the cost implication will be a key factor affecting access by Kenyans. What measures is the government putting in place to cushion Kenyans from the price shocks? There are quite a number. Let me continue. Dr. Ari, you mentioned that to increase access to medical products, Kenya must establish and coordinate research and development with research institutions and universities. Where are the opportunities and how can you work with civil society to make this a reality? Again, communities play a critical role in uptake of medical products. How are the government agencies, PPB included, engaging community views to enhance uptake of products? Still more coming. Multiple regulatory bodies have proven to be a barrier to access. What do we need to do as a country to accelerate legislation of a single regulatory body? And what is PPB doing to ensure Kenya realizes regulatory harmonization? That is quite a mouthful for Dr. Peter. I'll give him the floor first to respond to those ones as you wait for others. Thank you, participants. Keep them coming.
Thank you. So I'll go one by one. The first was a high level of hesitancy by public with regard to the fast-tracked products, and particularly the COVID-19 products. As you're aware, these products are novel products. No one has history, no one has experience on these products. So one thing we're doing is that we're treating them still as experimental drugs. So when we give, and we have applications, we received applications for remdesivir IV injection from 2 or 3 companies, And we've got also favipiravir tablets, and we've subjected them to our usual evaluation under the emergency use authorization, compassionate use authorization process. And what we're doing is that we ensure, we make sure that the guardians, the parents, or the people that are taking the medicines, at least they have to have signed a consent form. The medical doctor in Aga Khan or Nairobi Hospital or Kenyatta Hospital, they cannot administer that drugs until you've given consent for use of that drug. And that consent can only be given once you've been given information about the drugs, and particularly with regard to safety. That is the main criteria. What adverse events? And if you're willing to undergo that, then it's possible that the doctor will prescribe to you. Another criteria is the doctor, of course, has to use the risk-based approach. They cannot prescribe for medicine that may lead to more harm than benefit. So the first thing they look at is that, can you survive without that medicine? Then they can use what we call support, just the normal support, symptomatic management of the disease. So they may not prescribe that medicine. So they just give you like the usual things for management of fluids or any other use of maybe analgesics or any other minor drugs. So they may not administer based on the risk-based approach. So they will only administer that drug when they see that you have greater benefits than harm. So another thing maybe is engaging the public. We may need also to engage our publics through our public relations department. That is one area we may take up. Another thing we're following is that for these products, we will ensure that for products to be allowed also, there's a clinical trial phase whereby, well, they've been tested out, but we can also carry out a bridge clinical trials within the country as one of the centers. Remember that clinical trials are multi-center across the globe. So some of the clinical trials will be carried out in Kenya. And with this, we'll be able to know what are the adverse events and what are the risks, what is the efficacy of the product. Okay, another thing, question number 2 is once COVID-19 vaccine, as a vaccine comes up or it's approved, what will the government do to cushion from price shocks, to cushion the public from price shocks? Now, when it comes to supply of products, it's a government-to-government agreement. And usually this will be done through the Ministry of Health, the Director General of Health, the Principal Secretary, the Cabinet Secretary, and in liaison with the Ministry of Foreign Affairs and our respective embassies. Like now for US, because there is a vaccine that is upcoming there. We've got some vaccines by facilities within UK or Europe in general, UK, but particularly in Europe, UK. We have Oxford University that has come up with a good vaccine. And also China, they have some promising vaccine. So when it comes to availability or access and price, better price, it will be a government to government or bilateral agreement. So this way, the government can do mass procurement through the Kenya Medical Supplies Agency, and PPB will do regulatory approval, looking at its quality and efficacy, and after that, then it's taken up, and it can be supplied to public hospitals, faith-based hospitals, and our private hospitals for access by citizens. The next question, that question is opportunities for research and development. I've said that what we have is we do have research and development. We're very good institutes. The problem is we don't have any focus. I can say a central authority coming up with this. And that is why I was proposing that the Directorate of Pharmaceutical Services, because it is the directorate tasked with looking at the country needs, the national needs in terms of medicines. They are better placed to tell us, we looked at all this, we have deficiencies in this type of products. And then they can liaise with, through the Ministry of MOEST, that is Ministry of Education, Science and Technology, contact the relevant universities, be able to set up like a kind of GMP facilities And this, for GMP facilities, they'll be able to produce products that have patents have expired. As Mr. Onyango has said, once 20 years reaches, PPB has no barrier for registering those generic products. We call them generic products or multi-source products. Our universities, we've got professors, we've got so many researchers within these institutes that we are not using adequately. They can develop those formulations. Like us with our local manufacturers who can buy those formulations and carry on to manufacturing. Another way of doing it, if the local manufacturers are not willing because of the commerciability, you know, the aspect also of a product is commerciability. If they do not have a good market or their products we call orphan medicines, the government can fund that manufacture because it is its role as per the Constitution to ensure the highest attainable standards of healthcare. The next thing is, and I've said, funding now for facilities, manufacturing facilities. That would be now the last one. And this approach or model has been used in China to very great success. And they're doing from active pharmaceutical ingredients to all products. That is another area that can be looked at. Opportunities by investors. We've talked about active pharmaceutical ingredient. No one manufactures that in Africa, not only in Kenya, it's in Africa. The only country that is manufacturing an API, or one or two, is South Africa, manufacturing one API, and the Republic of Congo that is really extracting quinine from some trees, cinchona buds that is available in Congo. So generally, Africa does not have active pharmaceutical ingredients. And it will take us to have a regional approach through the East Africa community, through the African Union, so that once these products are manufactured, let's say in Kenya, they are easily registered or availed to the rest of Africa for them to be commercially viable. The next thing is also availability opportunities in manufacture of excipients that are used in manufacture of the finished pharmaceutical products. Manufacture of chemicals, manufacture of like ethanol, manufacture of reagents, manufacture of catalysts that no one in Kenya is manufacturing. Maybe ethanol is being manufactured, but we can increase capacity. That ethanol is not pharmaceutical grade. We need to have capacity to have chemicals that are pharmaceutical grade to be used directly in the industry. And that will create a lot of jobs. It will reduce the cost of our medicines because these materials are locally available. It will stimulate our industries from the API manufacturing industry to the finished product manufacturing industry to grow further and to export outside the country. Other key areas is medical devices and IVDs. As I've said, we were ambushed by COVID-19, and we've really done well for us to convert some of the apparel industries to manufacture for us PPEs. But we need dedicated facilities for manufacture of medical devices, and including the more complex medical devices that Kenya is not manufacturing currently. Also the IVDs, CHReaD would be the best to be strengthened to produce IVDs. We've got enough researchers there that are capable of manufacturing these testing kits. And I've said again, by liaising with the Directorate of Pharmaceutical Services within the Ministry of Health, that will not go in vain, it will not go to waste because it will be easily commercialized through through Kenya Medical Supplies Agency. And question number 4, engaging community for views. Yes, we do as Pharmacy and Poisons Board, we do stakeholder engagements, but I cannot say these are mainly the professionals. We need to go a step further and engage the people, the laymen, so that they can really appreciate what this Pharmacy and Poisons Board really is doing. And again, I think we will through our public relations office. In fact, we'll be carrying out surveys because that is part of our strategic plan for 2020-2025 to look at greater community engagement, to see like pricing, to see like about products, how do they view products manufactured in the country. But as I can see from the feel on the ground, which is not scientific, is that there's a lot of encouragement that people, they do, and they appreciate the locally manufactured products. But we need to do more on that. The question number 5 is multiple regulatory bodies. As a country, yes, we suffer political factors, which is a very big factor in Kenya. Everything is political. Making regulatory bodies is a political process. However, we are lucky that the Pharmacy and Poisons Board that was established way back several decades, as I've said, from 1957, was working as a desk or office within the Chief Pharmacist's office in the Ministry of Health, has really grown, and it is appreciated that under the Health Act 2017, the Health Act requires that there must be a single regulatory body such that it converges and is able to take care of the welfare of Kenyans. And that body, the biggest or the most developed body in Kenya currently in terms of regulations in healthcare, it is the Pharmacy and Poisons Board. Maybe the thing we may need to change is the name, because when people read poisons, they think the Pharmacy and Poisons Board is going to poison you. So we need to change the name, maybe to Food Drug Administration or something else, again, and also bring all these, like the veterinary board needs to be merged into, because this activity of regulation of veterinary products was being carried out by the Pharmacy and Poisons Board until the Veterinary Act came in force. However, as you see, developing a regulatory body takes a lot of time and a lot of financing, a lot of efforts. The Pharmacy and Poisons Board is a fruit of a strenuous effort by the ministry or the government, Ministry of Health, but also the development partners, including Bill Gates, including the US government through the USAID, including other bodies, including the AU, including the World Health Organization. And it has really taken a lot of time to really build in expertise. Yeah? The regulatory work requires scientists. It is not something you wake up one day and just start it off. It doesn't work that way. You develop scientists, and those scientists, when they come in the Pharmacy and Poisons Board, they have to be trained on regulatory aspects. So regulation is also a science. Maybe hopefully we'll be starting off masters and PhDs in regulatory science within the local universities, and that is also one of the plans that we need to start subjects in that. And by PPB, we've started a postgraduate course on pharmacovigilance, which is being offered through the University of Nairobi. The lecturers come from the Pharmacy and Poisons Board and the University of Nairobi. So you can see with these collaborations, you're building expertise, not only within the university, within the Pharmacy and Poisons Board, the regulator, but also within the university, within the universities and our healthcare professionals, such that maybe in 2 decades or so, we'll be having healthcare scientists that are ready to use or ready to go. They go directly, be able to be very useful within the regulatory area. They can work in CHReaD, they can work in industry, manufacturing industry, and this will really be of very good use in adopting and in developing technologies. Thank you. I hope I've answered the questions adequately.
Thank you, Dr. I believe you have answered them adequately. Just to emphasize that when it comes to communities and civil society engagement, look no further. CHReaD has the best capacity and linkages to bring in the strength and the capacities within the civil society. Thank you so much.
Thank you.
Yeah. Okay. I still have more questions coming. The next one reads, this is to John. How is CHReaD proactively making the market a fair playground, technology transfer while equally ensuring quality of medical products? Another one, how does CHReaD ensure that individuals in their private capacity can patent their products? I still have another one. I think this is to both Dr. and John. Thanks for the great presentation. Given the new free trade agreement with the United States, what local initiatives and leadership are you undertaking to promote investments and forums that links multinationals to the Kenyan market through local subsidiaries or partners? Thank you. So I'll first invite John to take the first two questions, and then I think the third one is for the both of you.
Okay. Thank you very much for the questions. First, regarding support PP is doing in terms of supporting individuals or the Kenyan businessmen, we are working very closely first with universities, research institutes. We have set up what we call focal points in a number of universities. Nairobi University, Kenyatta University, JKUAT, Egerton, Maseno, Masinde Muliro. So we have set up focal points and trained managers to sensitize the university community and research institutes and the staff on the importance of industrial property rights. Because first, these institutions, there's a lot of research going on. There's a lot of research findings going on, and they need to know how best they can manage their intellectual property assets. Because we have seen even inventions, if you take, for example, at Egerton University, in the fields of agribusiness, they come up with so many inventions in the ways of preserving food, farm equipment and implements, and this is from the researchers and the students community. So we are working very closely. We have set up units and trained them in terms of how they can manage intellectual property. Second, I talked about access to technological information. We have also set up what we call technology and innovation support centers in a number of institutions. These technology and innovation support centers allow them to access the databases I was talking about. We have set up a number in TVET institutions, Sigalagala, Sangalo Institute, and a number of places. Even today, I have a team that is visiting other TVET institutions to sensitize them so that we can be able to provide these technological information so that whenever they are exploring new products, they can be able to access this database and see what is already available in the public domain and do not need to reinvent the wheel. So that is really happening. We are working with what we call Young Scientists Kenya. There is a forum in Kenya for young scientists, people of the age 18 to 30, 35 years, who are involved in a lot of scientific work. So we are working with them together with the Irish embassy, the Embassy of Ireland here, and Strathmore University and the National Council for Science and Technology to support them, so that whenever they come up with something, we visit them and see whether these things can qualify as patents, as industrial designs, as utility models. If they don't meet the threshold, we advise them on the improvements they need to make so that they can be able to be granted patents at Kenya Industrial Property Institute. For the youth, and also even the small businesses, micro and small medium enterprises, we have waived fees for them. Whenever they come up with any innovations, we don't charge them fees. And in fact, these PPEs, the personal protective equipment, we have also waived fees so that, because we were facing a crisis. So to support universities, because a number of work has been going on in areas of ventilators, areas of masks, in areas of these PPEs, we waived fees so that it is not a hindrance for them to apply and get registration and protection. So those are things we have put in place, in addition to accelerating the time taken to process and grant them these rights so that we don't cause any unnecessary delay, because these are things that the public and the consumers really need them in the market like yesterday. With regard to the issue on the leadership, there's something going on. I hope you're aware of this. The Kenya USA Free Trade Association. There is a negotiation going on. You know, AGOA is coming to an end in 2025, and the US is keen on having a bilateral trade agreement with Kenya to allow their businesses to be able to trade freely in Kenya, and also Kenyan businessmen to be able to export goods freely into the US market. Now, there are various work streams and the negotiations are going on, and there is a chapter on industrial property rights because we want to harmonize the industrial property regime between Kenya and the US so that we can be able to protect both our businesses, businessmen, and also the US business community. Thank you.
Okay, thank you okay.
Thank you. Okay. Okay, thank you.
Okay.
Thank you so much. Okay, yeah, just go on, Peter, Dr. Peter.
Okay, yes, yeah, I think Mr. Onyango has really clarified. Yes, Farmers and Poison Board is part of also these negotiations. One of our members, and this is the Directorate of Trade Affairs, is involved there within, and we're in these negotiations. And it will look at how we would be able to make sure that their products coming in are registered quickly and that. So this one has not yet been finalized. Another thing is, again, the trade, apart from the trade agreement, whenever there are a foreign investor that is from any country, including the US, we do work closely with the Kenya Investment Authority. So they will request us if they want, especially in particular with technology transfers and all that. The Kenya Investment Authority will talk to us. Of course, they'll be contacting KP also, but they talk to us into picking for them who would be available, or which manufacturer or which Kenyan companies would want to be in partnership with the foreign investors. And this we've attained very well with the Asian countries that have done technology transfer. We hopefully hope that also the USA investors will do the same. And mainly the trade agreement will also boost our exports to the US. And that's why we're working very hard. As you can see, we put in stringent measures to ensure that our products manufactured within the country are of the highest quality so that they can be exported. And as I've given you an example, there is a Universal Corporation. There's another company also, by the way, which is also WHO pre-qualified, which is Questa, and it is doing what we call packaging. They're also doing the final step in manufacturing, and they are also able to supply the global market. So this is something good that is happening in Kenya, that companies are moving slightly over and over with time, going to international market. Thank you.
Thank you so much. There's one final question that we can't just let go because it's quite important. This is from Dr. Kibungo from CHReaD. He's asking, thank you, gentlemen, for the great presentation. How can we protect our innovation from being washed away by the cheaper imports? I believe this is for John. John, do you want to take that one? Hello, John.
The cheaper imports. Oh, hello, good afternoon. Because the issue of imports, we have the World Trade Organization, WTO, that provides guidelines in terms of ensuring that there is fair trade practices. And all countries that are member states of the World Trade Organization are expected to ensure that they meet these minimum guidelines so that there is no unfair trade between nations. Secondly, we also have locally within competing we do at level is no coded in the areas either of in terms of product quality, in terms of monopoly, and they ensure that the restrict dominance in the market. Particularly, the question didn't come up. I would touch substandard products, particularly goods that are getting into the market and they are either selling cheaply because they are substandard or they are counterfeit. And Dr. Mbiri had also talked about that. We have an agency called Anti-Counterfeit Authority that deals with ensuring that there is no illicit trade getting into the country. And there is a multi-agency task force that is now looking at this, that includes Kenya Revenue Authority, the Pharmacy and Poisons Board, I think, is also in agencies like the DCI. So they are all involved to ensure that goods getting into the country are goods that meet the minimum requirements. Even Kenya Bureau of Standards to ensure that all the products that get into the country meet minimum requirements and that there is fair trade. Now, these counterfeit products are really harmful. Pharmacy and boards can also attest to this in terms of affecting effect. So
I think we're losing.
Because what lead their pricing is that, yes, leading to.
Your network is becoming poor. We can't get you clearly. Hello? Hello? Hello. Unfortunately, we seem to have lost him because of network. I think I will request him to maybe type the response, and maybe we can respond through email. So with that, I think we are coming to the end of this very informative webinar. Sorry, John, that we could not hear the last bit of your response. Again, I will request you to just type and then we can share with the participants.
It's okay.
It was a very important question. With that, I really want to thank first our panelists, our excellent panelists, Mr. John Onyango and Dr. Peter, for your sacrifice, for sparing for us the whole afternoon. I know how busy you are to have time, like a whole afternoon for us. We really appreciate. For me, this was a learning webinar. I can assure you my notebook is full with the information that I've gathered from you. And we can assure you that as civil society and CHReaD, we are not just doing this as a routine. We are doing this because we feel the need to gather all this information and use it to inform the society and the communities about research and development and where they can plug in. We believe everybody has a role and has the capacity to plug in into this conversation around research and development and even innovation. So thank you so much. And to our participants, I want to also really extend my appreciation on behalf of AMREF, CHReaD, and PATH for taking your time and sending your questions and sending your inputs to this great conversation. I want to end with a quote that really inspires me when I think about research. That says, "Our greatest weakness lies in giving up. The most certain way to succeed is always to try one more time," by Thomas Edison. With that, thank you so much and have a great afternoon. No, it's evening. Thank you.
Thank you.
Thank you.